Gormagot, Cáithír, look, yeah, I think I have 4 minutes, so I might just speak for 2 and allow the other 2 minutes to the ministers to respond. Look, ministers, I would also disagree with Deputy Murphy, who's just spoke before me, that I do believe that both ministers have done their level best to address many of the concerns in the child sector. I suppose myself, I'm a parent of 2 children under 2, so I'm growing to appreciate the work that childcare workers do an awful lot more, and I suppose the impact that it does have in our pockets. And as Deputy Lahart and Deputy O'Callaghan mentioned earlier, it is becoming like a second mortgage, and I suppose I'm beginning to experience that for myself at the moment. But look, I think it needs to be acknowledged that the steps that government have taken. And I think it needs to be acknowledged that 80% of payroll costs and 50% of operational costs for the vast majority of these facilities has been covered because of the supports that both ministers have introduced. Minister, I just have 3 distinct queries or questions, and I was wondering if you could give me a comment. The first one is in relation to reimbursements, and I suppose I've come across some cases where childcare facilities, I suppose it's a question of, is it a question of must there be a reimbursement or should there be a reimbursement? And it's just, I suppose the importance around that language is because I'm coming across some facilities where that reimbursement isn't forthcoming, or there seems to be some kind of confusion around it. So it's just to clarify around, must it be reimbursed or should it be reimbursed? And the second one is just in regard to pregnant care creche workers. And I suppose I'm just reading from the guidelines that pregnant teachers and SNAs are to work from home as part of these temporary arrangements, while advice for pregnant education sector staff is developed by occupational and public health doctors. And I suppose if you could just give me some explanation as to why that distinction is there. Like, I suppose, what's the difference between a teacher and an SNA being allowed, if they are pregnant, to work from home, as opposed to somebody working in the childcare sector. So I think it's important that distinction be explained. And just my final question is regarding the JLC, and I welcome your comments today that it's progressing. I know that obviously you can't reveal too much, but if you have anything else that you can elaborate on in terms of how that process will unfold, I'd appreciate it.
Minister, briefly.
Thanks, Deputy, and look, thank you for your comments, but I'm aware that we always have more to do in this sector, particularly on the issue of pay. As regards reimbursements, for the period of the 1st of January to the 5th of February, we didn't have any legal requirements on, we didn't have a new contract in place with childcare providers, so we could not compel reimbursement. So during that period, we requested that childcare providers make a reimbursement. For the next period, the period of 5th of February to the 1st of March, if childcare providers want to avail of the enhanced package of funding, they must sign a new contract, and including in that is a commitment, a mandatory reimbursement. They don't have to sign up to that new contract, but if they want to avail of the enhanced funding, they must sign up to it and make the reimbursement. The JLC process is one that I am confident will be able to deliver a significant increase in the wages of childcare professionals. It will involve the SIP2, it will involve Childhood Services Ireland, but I will receive more detail hopefully later on in the week, and I'll let deputies know about that. On the issue of the guidance as regards childcare professionals who are pregnant, all the information our department uses is based on public health guidance from the department, from the HSC, but I might come back to the deputy in writing specifically on that, so he has a clear understanding. Thank you.